Ladies and gentlemen, you're very welcome here this morning to the Mansion House at the launch of the Caru programme, supporting nursing homes to deliver palliative, end-of-life and bereavement care. Thank you for coming here in such numbers, firstly, just to say that. And we also want to welcome those who are watching us on a live stream this morning. This whole idea has been developed by the Irish Hospice Foundation in partnership with the All-Ireland Institute of Hospice and Palliative Care and the Health Service Executive. And I also want to make special mention today of the support which is from Kingspan, who are here with us today, based in County Cavan. Siobhan is here, and she's taken orders for new houses if anybody has any money left. But I just want to thank her for being here today, because that's very important, without whom, obviously, lots of things don't get to happen. But you're very welcome here today. We want to talk about the collaborative nature, obviously, of this particular programme. The attendance of so many different areas, diverse groups here today will be proof of that. Nursing homes, community services, hospices, family members, older people, acute hospitals and voluntary organisations. It was funny, when I was coming in here a few minutes ago, I met a gentleman outside. I will only say he was a man of a certain age. And I said to him, are you coming into our event? And he said, no, thank God. And he would have meant that, obviously, in a funny way, but by the same token, without something like we're talking about today, when we talk about bereavement, we talk about palliative care, we talk about the wonderful work of the hospice, it would be a very different world. So even though he's not with us, I suspect he may be here in spirit in some way. Anyway, I want to welcome, we have residents and families and staff from all over the country joining us on the live stream, so we want to welcome you today. Maybe give them a little wave or a little round of applause or something, just to say hello, and we're glad you're with us today. Now, we have a number of speakers who are here with us today, and just to let you know that while you are not here, you can submit questions, if you want to do that, to us here today, and if we can get a reply on the stage, on the podium, lovely. If not, we will ensure that we will get somebody to get back to you. So that's very important to say. And we've made sure that you can see the stage properly and you can see all the people who are speaking. We had to move somebody who had too much hair, apparently, earlier on, which is quite something. Not a problem for everybody, Tyke, I think you'll agree. But I have a phone number I can give you. Now, just before we go any further, I want to welcome, well, I can't welcome because she's not here, because she's tied up, the Minister for State with responsibility for mental health and older people, and that's Mary Butler TD. She's not here, but she is in there. Eventually.
Good morning, everyone. I am pleased to launch the really important Caru programme, supporting care and compassion at end of life in nursing homes. I must apologise that I can't be with you in person today to announce this welcome initiative due to a requirement to attend the Oireachtas Committee on Health. The programme really does have the potential to deliver a step change in the way palliative, end of life and bereavement care is delivered in long-term residential care facilities for older people. Most importantly, the programme has also been developed with the service user at the heart of its design. At all times, the voice and choice of older people needs to be heard. Caru is designed to be a continuous learning programme with the specific aim of supporting and empowering staff in residential care facilities right across the sector in the delivery of palliative, end of life and bereavement care. It aims to reach widely across the staffing community to better equip those working day in and day out with residents, with the ultimate objective of further supporting the delivery of high quality and compassionate care, particularly at end of life. This is what residents and their families deserve. The COVID-19 pandemic shone a light on the vulnerability and fragilities within our system of care for older persons. But I do believe that there can be a positive legacy out of our experience with the pandemic. The work of the Nursing Homes Expert Panel in 2020 has provided us with a solid framework for reform and improvement across the sector, and we are seeing progress in implementing its recommendations, this programme being one of them. I would like to acknowledge the commitment of everyone involved in this programme in responding positively and comprehensively to the recommendation from the expert panel to develop a programme of this nature. It's heartening to see that significant progress has already been made, with the national office already established and a number of regional leads in place, webinars being rolled out and educational resources being made available online. I remain committed to supporting this programme, and my department has committed annual funding of over €1 million through the HSE for the first 5 years of the programme to match funding being provided by the programme partners. We all know and appreciate that end-of-life care is something that is difficult to talk about, but it is extremely important that we do so. This is something we all must get better at, but it is especially important for staff working in our community nursing units and nursing homes, where end-of-life care is a core aspect of their daily work. On average, in the region of between 7,000 and 8,000 people die in these settings every year, so it is essential that staff are equipped to deal with this. The Caru programme has an emphasis on supporting and training staff in long-term residential care facilities to enable them to have these important but difficult conversations with their residents and family members. It will support staff to have the knowledge, the confidence and the resilience to deliver excellent, compassionate palliative, end-of-life and bereavement care and support. In conclusion, I would like to once again acknowledge the contribution of the partner organisations that have developed the Caru programme, and in particular I would like to thank Siobhan and Kate in the Irish Hospice Foundation, Karen and Miriam from the All Ireland Institute of Hospice and Palliative Care, and Stephanie and Morris from the HSE for their ongoing commitment and dedication to the programme. I would also like to recognise and thank Kingspan, who are generously supporting the programme. Finally, I would like to also acknowledge the tireless work done by Sharon Foley and indeed all the staff of Irish Hospice to bring this programme into fruition. As you may be aware, Sharon has since left the Irish Hospice Foundation, and it would be remiss of me to launch this programme without formally acknowledging and recognising her enormous contribution to this programme. Thank you again for inviting me to speak to you today to make this very positive announcement. I wish you all continued success with this programme. Gorv Mila Mahagut.
Very nice. Thank you, Minister Mary Butler. Just curious, is there anybody here from the hospice over in Raheny at all? Anybody here from? Are you? Yeah, you've done amazing work. Remember when my dad was sick, you were terrific. And Cecil Nolan, who is, not that any of you care less, but he was a disc jockey, ladies and gentlemen. And he ran a disco on the north side of Dublin called The Grove. And I met my wife there, so it's very special. And she wasn't married at the time, clearly. I met her when she was single, as indeed as I. But I make the point only that he was minded beautifully by the hospice over in Raheny, and you were amazing. So just wanted to say that. So now, ladies and gentlemen, with that in mind, I want to introduce the Director of Healthcare for the Irish Hospice Foundation, Siobhan Murphy.
Good morning, everybody, and just to reiterate, a very warm welcome to everybody who's here today, and also to those who are joining live stream to hear about our Caru programme. Today's a really exciting day for us in Irish Hospice Foundation as we launch the programme. And as you've heard already, Caru is a continuous learning programme, and it's been developed by Irish Hospice Foundation in partnership with the All Ireland Institute for Hospice and Palliative Care and the HSE. And you'll hear more from Karen and from Stephanie in a few minutes about how they have evolved with this programme. But I'd like to talk to you a little bit more about how Caru has evolved for us within Irish Hospice Foundation and what we hope the programme will achieve. We all know that death happens, and we think that up to 1 in 4 of us will die in a nursing home. And providing compassionate care for residents as they approach their end of life is a fundamental component of holistic, person-centred care. And we also know that it's what nursing homes do very well, and they've been doing this for so many years. But it's what Caru is all about, supporting and empowering nursing homes and their staff to continue to deliver really good palliative end-of-life and bereavement care to residents and their families. This work is at the heart of what Irish Hospice Foundation is about, and we do this through many programmes. And underpinning all of our programmes is very strong collaborative partnership working with others, with the HSE, the Institute, Irish Cancer Society, the ICGP, Nursing Homes Ireland, HICWA, and others. And our vision is an Ireland where people facing end-of-life or bereavement and those who care for them are provided with the care and support that they need. We believe that every death matters, and you only have one chance to get this right. We help to bring hospice principles into acute hospitals with our hospice-friendly hospice programmes and into nursing homes with this programme. And our Nurses for Night Care service supports those dying from non-malignant conditions to stay at home. And we do this in partnership with the Irish Cancer Society and the HSE. In Irish Hospice Foundation, we also promote discussion on a broad range of issues related to dying, death and bereavement, and we help identify what matters most to Irish people and to those at end of life, and how best to address those concerns. Nursing homes are settings that are not new to Irish Hospice Foundation. We've led on a previous quality improvement programme called CUL, Compassionate End of Life, and that has set a very strong foundation and was actually one of the key influencers for this programme. Supported by our colleagues in the All-Ireland Institute for Hospice and Palliative Care, through the Project ECHO, we believe that Caru will continue to promote the importance of palliative, end-of-life and bereavement care in nursing homes. The experience and expertise of the partnership, this will be very vital to the success of this programme. Caru, as the Minister has mentioned already, has evolved in response to the COVID-19 Expert Review Panel report, which recommended a joint HSE-IHF programme, a collaborative programme, national programme that will look at end-of-life and bereavement care for the nursing home sector. The report recommended that this be established along the same lines as the HSE-IHF Hospice-Friendly Hospitals programme. Caru focuses on enabling cultural change within nursing homes, encouraging openness to talk about and plan for end-of-life care with residents, families and staff. It builds on the capacity of the nursing home to enhance the staff confidence with planning for and reviewing care at end of life. It also supports the staff, residents and family in their bereavement. It incorporates a multidisciplinary team approach, recognising that all staff, from the catering to household, healthcare assistants, porters, administration, as well as nursing and management, all have a vital role to play in providing end-of-life care. And Caru enables staff to continuously review, reflect and improve end-of-life care that they provide for residents and their families and also for the staff. The programme embeds a continuous quality improvement approach and it's built around the needs of the individual, with the resident always at the heart of every decision. Nothing about me without me. Good end-of-life care is about being supported to live well until you die. The recent National Nursing Home Experience Survey in 2022 carried out by HICWA highlighted that residents, their relatives and friends mostly reported a positive experience in their nursing homes. The areas that they noted for improvement included being involved in planning ahead for changes and in circumstances and decisions that affected their lives. This was also reflected in the insights that we gained from research that we carried out to inform this programme. And so this positive experience, combined with the identified areas for development, we think provides a solid foundation that Caru can support nursing homes to build on. For staff, the nursing home is a workplace where death is a regular part of the working environment. Staff develop strong relationships with families and residents, and part of the Caru programme is ensuring that staff are supported to recognise their own grieving needs, that they reflect on how they're coping with the loss of a resident, and that they're encouraged to support each other. Staff will also be shown effective ways to review the care that is given at end of life, thus ensuring reflective practice, peer support and shared learning. Remembering the resident who has died and their life in a nursing home and the people who loved them is an important aspect of reviewing the care given at end of life. And just to illustrate this, I'd like to share a story with you about a lady who lived and died in a nursing home. Evelyn had been in a nursing home for several years and had over time had become very close with a number of the residents. She had a very, very supportive daughter called Maura, who was her only child, and she had a husband, Jim. Evelyn had significant health issues and she was experiencing regular admissions to hospital. And the nurse in charge expressed concerns regarding her admissions to hospital, as each time Evelyn returned to the nursing home, she was more fearful about the next time she went to hospital. A member of the staff team was encouraged to talk to Evelyn and ask her what her concerns and fears were, and allow her the opportunity to open up about how she felt. 3 things Evelyn identified. Evelyn was afraid not to go to hospital, as she felt her family would be upset and they might think that she wasn't trying to live for them. She was terrified that she would die alone in hospital, as her family may not be able to be with her. And she also felt she couldn't ask questions to the doctor because the doctor knows best. So following this conversation with Evelyn, and with Evelyn's permission, the concerns were highlighted to her GP and her family through a facilitated meeting in the nursing home. And it was then agreed that into the future Evelyn would not return to hospital and she would be treated in the nursing home. This meeting was really, really helpful because as her condition deteriorated, people were aware of her wishes, and Evelyn was assured that she would stay in the nursing home. As Evelyn was dying, her friends in the nursing home were told about her worsening condition. They expressed their appreciation for the staff's honesty, and they reassured Jim and Maura that when they were not there, that Evelyn would not be alone. Evelyn died soon after in the nursing home, as she had wanted, supported by her husband and her daughter, but also her extended family, the staff and the residents in the nursing home. So when I think and talk about a good death, I think of Evelyn. She was supported to talk to her family, and she was clear on her end-of-life wishes. And this gave the staff in the nursing home a great sense of pride in their work. They knew that they had facilitated Evelyn's wishes. They felt supported to have those conversations with Evelyn, with her GP and with her family. And they also loved the idea of including the other residents, because previously Evelyn's imminent death may have not been discussed, as not to upset the other relatives, or the other residents. In my mind, Evelyn's story embodies what Caru is all about. It's about enabling and supporting staff to have uncomfortable and important discussions and conversations. It's about ensuring that they have the courage and confidence to believe in the great care that they are providing. And it's about ensuring that staff, residents and families are given the opportunity to acknowledge people's deaths. We know that there are so many examples like Evelyn's out there in our nursing homes. And we also know that there are many nursing homes who want to have the opportunity to improve the palliative end-of-life and bereavement care in their nursing homes for their residents and their families. So I'm just going to finish with a quote from Dame Cicely Saunders, who is noted for her pioneering work in palliative care and within the birth of the hospice movement. She said, "How people die remains in the memory of those who live on." We want to ensure that through the Caru programme, we support people to have a respectful, dignified death, defined by them, and supported by those who love and care for them. Thank you.
Thank you, Siobhan. Siobhan Murphy, Director of Healthcare at the Irish Hospice Foundation. And I want to introduce the Director of the All-Ireland Institute of Hospice and Palliative Care and a co-partner in the Caru programme, and that is Karen Charnley.
So, hi everyone. The All-Ireland Institute of Hospice and Palliative Care was delighted to be asked to be part of the Caru Continuous Learning Programme for nursing homes. And we're very much looking forward to continuing to work with our colleagues in the Irish Hospice Foundation and Siobhan and Kate and the HSC to support nursing homes with their delivery of excellent palliative and end-of-life care to their residents. The Institute is driving out on 3 strands of the programme, and this work is being led by my colleague Miriam Ahern, along with my other colleagues, Joanne Morgan, Denise McGreevy and Yvonne McCahill, who are here in the audience. Firstly, we are organising and facilitating a series of 6 webinars annually. These online interactive events focus on a wide range of topics which reflect the complexity of both palliative care and the care of older people. They include areas such as clinical knowledge, symptom recognition, patient management, and current best practices. The webinars include a presentation from a leading expert in the area, and participants have the opportunity to ask topic-related questions prior to and during the session to the speaker and the panel members. The webinars are available to all nursing home staff, and the videos of the sessions are made available following the day. Secondly, we are leading out on the Caru AII HPC, had to put my teeth in for that one, Project Echo Nursing Home Knowledge Networks. Project Echo is a distance learning model that is practiced globally. It breaks down hierarchies of specialist knowledge by creating virtual networks of community and practice. Through an online virtual learning programme, ECHO develops the capacity of nursing homes using specialist input, case-based learning and peer support. Caru Project ECHO networks will support the development of local knowledge and skills and the confidence of nursing home staff in caring for residents with life-limiting conditions. It will also provide a valuable opportunity for staff to network and share practice with a wide range of their peers. During the Caru programme and on a phased basis, one Project ECHO knowledge network for local nursing homes is being delivered in each community health organisation area, with the support of a specialist palliative care provider within the area. The first Project ECHO network is just starting in CHO Area 7 and is being delivered in partnership with Our Lady's Hospice and Care Services. The second Project ECHO is taking place in CHO Area 9 with St Francis Hospice. And great to see Regina here in the audience today. And we have our first information session for nursing homes for this ECHO very shortly. And finally, the Caru programme will be supported by a suite of online learning resources which will be available to all nursing home staff. These will be hosted in a newly developed dedicated area on the Institute's existing online learning management system, the Palliative Hub Learning Platform, and we'll be launching the Caru area in the very near future, so we'll be circulating details. I would like to reiterate the Institute's appreciation for our invitation to be part of this programme, and we're very much looking forward, as I mentioned, to working with the IHF and the HSC. Thank you very much.
All about cooperation. Thank you, Karen. Now I want to introduce Dr. Stephanie O'Keefe, who is National Director of Operations and Planning at the HSC. Give her a welcome.
Thank you very much, colleagues. It's my absolute pleasure to be here today and to be partnering with the Irish Hospice Foundation and the All Ireland Institute on the delivery of the Caru programme. The aim of the education programme, as Siobhan has already set out so clearly, is around enhancing the provision of compassionate, person-centred, end-of-life bereavement care to staff, by staff to residents in nursing homes and their families, putting the individual at the heart of practice. It's particularly a kind of a dear programme for me. My own father-in-law passed away during the summer in a nursing home. He'd gone into the nursing home 3 years before that. And it really brought to the fore for me the importance of this programme, and particularly the fact that it needs to be embedded and be a success. Susan was just mentioning that to me before as I came in today. So I'm absolutely delighted that we have the calibre of people working on this, embedded, as Siobhan has already said, by a really strong partnership approach. Siobhan, you're bringing an incredible kind of programmatic and very sensitive approach to this work. And it's very, very impressive. Maurice Dillon, who works with me in the National Office for Palliative Care, is doing tremendous work and had been working in the Department of Health on palliative care policy. And as Karen has already spoken from the Institute, reaching out to our nursing home and our residential partners across the country. It's a very complex piece of work. It's a very complex ecosystem to be able to develop this programme using an evidence base and to implement it in practice. It's a big ask, but I'm absolutely assured that we have the best possible team to deliver it. Maurice is working very closely with our hospital and our community colleagues. Siobhan has done a great job on recruitment to date, and we have the financial structures in place. And thanks to Siobhan from Kingspan for that to have a kind of a wider partnership model there. So we really have got the seeds of a very important piece of work and something that will make a very meaningful difference to people, hundreds of thousands of people around the country, in the future of residential care in Ireland for people who are at end of life and in need of palliative care services. And I would also like to draw attention to another piece of work that we did, just for people in the room that mightn't have heard about it, that we did with the Irish Hospice Foundation in terms of developing a campaign highlighting the supports that are out there for people who have suffered from bereavement or grief or relived grief over the period of the pandemic. It has been an extremely difficult time for people living in Ireland and, of course, globally. And it brings up an awful lot of things for people, during the pandemic, people being isolated, kind of cocooning, but also the actual experience of death and dying over the period of the pandemic has been extremely difficult for many people. And we wanted to draw attention to that, because some people, they're not acknowledging the fact that is an issue within their lives, and there's actually a lot of supports out there. So we did a really lovely piece of work that feeds in very nicely and will become very important to this project as it evolves, trying to highlight to people the supports that are available. And if you go to hse.ie/grief, or you go to the Irish Hospice Foundation website, you'll see all the details there, and there's posters and information and counselling supports, and of course the IHF helpline is there for people as well. And it was really interesting when we launched that. It was mainly a social media campaign, so very targeted. The group that actually responded kind of mostly to it, actually at a higher level, according to our communications colleagues, was actually younger males, which normally is a difficult to kind of reach group within the kind of target audience. And then what we then did after that with the Irish Hospice Foundation was we extended it to have a bespoke set of supports for people who have been working during the pandemic in healthcare. So not just HSE employees, but staff of nursing homes and residential care centres, staff in ICUs who would have seen a disproportionate amount of death and dying professionally. Again, the evidence base there being really important, that actually culture, local culture and peer support being the most important protective factors for people in terms of coping with death and dying as part of the work that they do every day when they come into their jobs. So I just wanted to highlight that here, and for people maybe listening, that if there's an opportunity for you within your professional or personal life to bring that to the attention of others, that would be really, really great. So I probably haven't said anything that I have written down in these notes now, but I hope I've managed to communicate that the HSE and myself and my colleagues and Maurice with all of us are very, very committed to this project, and we'll make sure that when there's lumps and bumps on the road ahead, as naturally there will be with any project, that we will be there to support resolution and making sure that this is a success. Thank you very much.
That was fabulous. Thank you. That's Dr. Stephanie O'Keefe. You don't need notes at all. You don't need notes at all. And I want to introduce now the Global Head of Marketing and Public Affairs at Kingspan Group, who are great supporters of the IHF and the Caru programme, and that's Siobhan O'Dwyer.
Hi, everybody. And I really don't have notes because this is a very, very short speech. I'm here really to speak on behalf of Jean, our CEO, Brendan and all the family there, Eugene, his father, and all of their families, and indeed all of the people who work in our Irish business in Kingspan. The relationship with the Irish Hospice Foundation is a really important one. It means a lot personally to all of us, actually, at Kingspan. Even though we're a big business, we're a close-knit family business, and all of us have seen what each of us has gone through over the last few years with the pandemic, and so to be able to support something like this is a huge privilege for us. We've worked with the Irish Hospice Foundation for many years on their annual fundraising cycle, and in fact many of our senior leadership team, including Jean, goes in cycles every year, and they're putting quite a lot of pressure on me to do the same, but I don't cycle, so it's highly unlikely. But and through that experience, we've got to know the Irish Hospice Foundation, we've got to know Helen and Sharon and all of the team, and we've got to really appreciate the quality and the importance of the work that they do, but also the professionalism of the organisation. It's just a phenomenal organisation. So when Sharon approached Jean, and obviously Sharon would have got to know Jean well over the years, and Helen too, about Caru, he immediately felt that it was a really important project and immediately wanted to support. So really on his behalf, we just want to say how privileged we are. I know it's going to touch people on a very personal way in Kingspan, and we're just so proud to be able to support it, and we wish all of the partners involved in the project every success with it.
Very impressive. That's very impressive, it really is. Now, we just want to thank our speakers that we've had so far, Siobhan, Karen and Stephanie. If you just give them a round of applause just before we move on to the next bit of business. And we have a panel that are going to take their seats. Can you make your way over here? Is that okay? If we just welcome Orla Coleman, Director of Nursing at St Luke's Charity and Home in Cork. Vandana, as a fellow said, we'll do it all together. Vandana Iqbal, Director of Nursing at Clonskeagh Community Nursing Unit. Tig Daly, who is CEO of Nursing Homes Ireland. Dr. Paul Cregan, GP and Consultant in Palliative Medicine at Our Lady's Hospice and Care Services in Blackrock and Dublin. And Kate Steele, Caru Programme Manager from the Irish Hospice Foundation. Will you give them a welcome, please? Now, they're all mic'd up, and again, if you have questions from home, feel free to send them our way. Orla, can I start with you, and just the positive difference when supporting a resident to die? What are we talking about here?
I suppose this programme and this collaboration with the Irish Hospice, HSC, and also the All-Ireland Institute of Palliative Care and Hospice, I suppose can only help to develop and blossom really the palliative piece in nursing homes. I suppose Siobhan quoted earlier a wonderful lady, Dame Cicely Saunders, the founder of the hospice movement. Yeah. And I suppose my mantra in our workplace, and I know many of my colleagues also in the multidisciplinary team, would be, I suppose, you matter because you are you, and you matter to the end of your life. And that's really something we take home, I suppose, especially in the assessment that you'd have with a resident coming in. It's a huge step coming into a nursing home. You may or may not have a palliative condition, for example, dementia, but you may have a ream of comorbidities. So you're coming into a nursing home, a huge step, huge anxiety, and you have a fraught family and loved ones also. So for one stage, there's a piece of grieving sometimes is happening on the initial step. But I suppose what we aim to do in nursing homes and what we're trying to drive through is that it's all about the living. And there's a lot of living goes on in nursing homes. We've had so many activities, christenings. Unfortunately, COVID might have not helped that. We've had marriage celebrations, which was lovely, when coming in, post events. So there's a lot of living happens in these homes. And I suppose this programme will only kind of grow and blossom on that. And I suppose, again, looking at impeccable symptom management for staff, that they'll have the knowledge and skills of what medicines to use. But I suppose more important than that, and something that I would just speak to my staff a lot about, and even personally, I've lost 2 parents during COVID, it's actually the kindnesses that people, yes. The act of kindness. It's that cup of tea at 4 a.m. when you're exhausted and you may be in an end-of-life stage for about 5 or 6 days, and it's that talk, it's that conversation. And it's wonderful if you know the family, and I think that's why in nursing homes it works really well, because you know the family. You have a palliative approach, there is the family, there is the resident, you're a whole unit, and your relationship blossoms. So when you have someone approaching end of life, then Marty, it can be really challenging also for the staff, obviously the family as well, but you do it in a supportive manner.
And there are relationships built up as time goes on.
Absolutely,
yeah.
Absolutely. And even I suppose post-bereavement, we're lucky that we have contacts with a great social worker and advocacy as well, such as SAGE, all these external services. But I suppose the resident has come not only with the family in a unit, but also with expertise from all the acute services. Your cardiology, respiratory teams. So they're all feeding into the journey really of
yes.
the resident and the family. Yeah. It can be busy, can't it, Vandana? Yeah.
Well, thank you for that. Now, when it comes, Vandana, you are Director of Nursing. When it comes to Caru and the improvement it's going to make, what do you see as the vital ingredients here from your point of view, your perspective?
Okay. Thank you so much for your question. I believe the approach itself represents HSE because Clonskeagh is a HSE nursing home, care, compassion, trust and learning, which is also, I can really connect that that's what the aim here is. The first thing that I can see is staff development. And that is incorporating not only nursing skills that are really essential, that will be part of it as educational and peer-to-peer reviews. But however, it's the person here connecting with the person there. That's the family and the residents that are part of that. So there's a partnership in this that I see is at the core of any quality improvement service delivery. So there also is collaboration in this from quality improvement, that it's not only the nursing team, anyone who works in the nursing home, even the other people who come in, like the hairdressers, the priest coming in,
all the
should
things
be
that
all
are,
part
that are
of
normal
that.
every day.
And
exactly.
yes, so, and that's one of the things that I see in this project. Again, quality improvement at its core. There is also a lot of integration in this. That's a real nice development, and a long-term goal here is that there will be community, there will be GPs, there will be acute setting, and nursing home all coming together to deliver a good end-of-life experience for a person who has reached there. And one of the examples I would like to give from the previous project we were part of, that is Caru. And during COVID-19, everyone was badly affected. The first wave, no one was allowed to come in. This project, the previous project, helped us measure the service delivery. One of the examples was someone gave us feedback telling us that they knew they were not allowed to come in, but they could see their mother from the window, and they could see how her hair was done exactly how she wanted before she passed away. Yes. And that is the beauty of this project. There are quality improvements that happens that you measure goals, but there is something that you feel as well. So this
because
brings
people up
everything
to the end
together.
have needs. They have, and they must be respected, and they must be given those moments that they will cherish as well,
Yes.
and the family as well. Thank you for that answer. Ty, from your point of view, we see you on the television fighting the good fight from time to time. When it comes to an event like this and an idea like Caru, is it? There will be falls, but you have to pick yourself up and move on, I'm sure.
Yeah, absolutely, and we're obviously delighted to be here today again. We've been involved with the Hospice Foundation for a long number of years, the COL programme, with the forerunner of Caru. So it's a hugely important initiative. I think Siobhan mentioned the figure earlier on. 7,000 to 8,000 people die in nursing homes every year, and I think that's an important element to say that, because sometimes people feel that they should be transferred to hospital at the end of life. What nursing homes do, public, private and voluntary, they do a fantastic job in my mind, and that's down to the staff. So that's why this programme is so important, is to, I suppose, reassure staff, support staff, to be able to enhance their practice, because they do a wonderful job already, but of course it can be improved. Yeah. And I think the other point that Vandana mentioned there is that sometimes, I suppose, when you think of death and dying or bereavement generally, it's not left to the medics, the clinician, whether it's the GP or the consultant, or indeed the nurse or the carer. I mean, the nursing home is a community. It's the gardener, it's the chef, the HCA, the cleaner. And that's why this programme is so important, because all of those staff, they become part of a community. My own daughter works in a nursing home, so I know it from that point of view as well. And they make a connection with their, as they see their residents. They know them. They know their family. So it's important that they're supported to deal with the grief as well. So obviously the grief for the family and grief for the person who has passed away, but there's grief among the staff, grief among the other residents. And that's why this programme is hugely, hugely important. And yes, there will be bumps along the road, there'll be huge challenges, but what we've been through in the nursing home sector has been the single biggest challenge, I would say, in our lifetime. And we stood up collectively, very proud to say that. It was challenging, absolutely, hugely challenging. Yes. And that's why, I suppose one of the challenges will be, staff are exhausted. Staff are burnt out, probably. Staff sometimes leaving the sector because they feel they could maybe have a job somewhere else. So that's why initiatives like this and training and development, because I see it every day of the week. Staff have an insatiable appetite for further education, continuous professional development. We put on a webinar in the morning on activities in nursing homes with 300 people. It's oversubscribed before we even announce it, Harley. So that's why this programme is so important. And to embed it in practice is hugely important. And to have all of the actors involved, the HSE, obviously, the Hospice Foundation, the All-Ireland Institute, ourselves in Nursing Homes Ireland. And nobody has a monopoly on wisdom is one of my quotes. Yeah. Despite my best efforts, I try to be of wisdom all the time, but I know
we all know you're full of it.
I know
you're full of it, right?
I know I can't do that, but
we're fully versed.
That's why it's important that all of the players, everybody brings something to the initiative.
Absolutely.
So it needs to be hugely supported, and I can assure you from an NHI point of view, and I know from talking to our members across the country, let's get this rolling. And the fact that there are people in the CHOs across the region is hugely important, because that's the team who are going to drive it. It's all very well having a national footprint, but we need people on the ground, and
that's right.
We're very excited by the people who have been appointed, and they'll do a great job with the support of everybody.
Good man.
Yeah.
It's hard to get a word out of Tig, but he does his best. I've known Tig a long time. I have great respect for him. Dr. Paul, you're of course somebody who is very supportive of life care in the nursing homes. And when it comes to an event like this, from your point of view, you quite often will be the one who will have to impart the news to a family and all of that.
Yes, I mean that's part of our role as a GP, and also as a palliative care physician. So we do a lot of breaking bad news. But I think just to talk a little bit about the programme, I was listening to the choir at the start there and how hard it is to do a 4-part harmony. That was really fabulous. But it just tells you that's a microcosm of how palliative care works. We have to dovetail with all players in a team. And as GPs, as palliative care physicians, as palliative care nurses coming into a nursing home, if you can, we're not all singing off the same hymn sheet all the time, but if you can harmonise what you do, it makes a huge difference to the care of these people. And as a GP coming in, it's really helpful to know that the people who you're seeing in nursing homes have at least a fairly good knowledge of the direction of care and where this is going. So this programme is really helpful around that. And a lot of the decisions you make as a GP, you're pushing an open door with that kind of knowledge in the background.
Sure.
That's especially so at night time. And I was just listening to what Tig, he reminded me of the importance of out-of-hours care for general practice. Because if you have a reasonable base of knowledge within a nursing home, it makes those decisions much better, much more valid that are made late at night. Will I transfer somebody to an A&E department to spend 2 days in an A&E wrongly placed for their dying, or do they need to be here? So a lot of that preparatory work can be done prior to that GP arriving at 2 a.m. who doesn't know the patient and who doesn't know the family.
That's right. Again, it's that integrated approach.
Really helpful.
The only way. Kate, from your point of view, you're the programme manager for Caru. How are you feeling today, by the way? I should ask you that question first.
Not so bad. Good.
Yeah, because I think it's going rather well.
Yeah, no, it's a really nice so far.
We've had no abuse at all from the floor, which is terrific. Not yet, but Orla seems to be expecting it, but there we are. But from your point of view, it is about that, isn't it? It is about partnership, about collaboration, about communication, about all of those things together, isn't it?
It is. And I'm really just going to reiterate what everybody's been saying. Nursing homes, they're people's homes, and we say that all the time. But they're also actually really important structures in our local communities. And it's about making sure that when we're providing the palliative end-of-life and bereavement care, if we want to do that holistically, person-centred, we really need to know what the person wants. Yeah. So we bring it back to that. And you mentioned, Orla, that journey, that life journey through a nursing home. And it starts before and it starts with these conversations. And if we can empower staff, we can empower families, start having these conversations with the team. If you go back to Evelyn and that example of Evelyn was empowered to talk about it, to talk to her family, to her GP. Then you take it to the wider, like who else is needed? Who do I need to be involved in here? Do we need to be talking to the acute hospitals, specialist palliative care services, wider? And we always asked when we would be doing the previous programme, when you were talking about team, look at that wider team. Where are the funeral directors? Where is your alternative medicines? Where is the GP? Where's everybody in that? Bereavement services, the list will go on. But it's about coordinating and networking together and putting that person's wishes
centre.
It is, because what you're doing there is you're planning and you're preparing. And again, as you said, if you planned and prepared, there's less likelihood then for those 4 or 5 o'clock in the morning or weekend, okay, what do we do? Because I do remember in one of our previous talking to a member of staff saying that when staff knew what the resident wanted, they felt more empowered, that they were able to actually give those wishes and not actually felt that they were imposing their own care wishes, but it was that person and with family's consent, end-of-life care wishes.
That's I was like Orla said at the beginning, it's about they're at the centre, it's about them. Ladies and gentlemen, our panel here today. Actually, Kate, I have a question that was sent. Somebody working in a nursing home and wondering how they can avail of the programme, just to kind of kickstart that concept. How can they avail of the programme from now on?
Well, again, what I didn't get a chance to say is we're delighted, and we mentioned we're going to have regional leads around the country, and each CHO will have a regional lead. So from the nursing up and their staff, we have about 4 or 5 in place at the moment, and we'll have more in place. So contact us in the national office or through our website. We are launching a new caru.ie, but our staff will be getting in touch with each individual nursing home in the coming months. Yeah, well, some have started now, and
sure,
as we go on.
Sure, no worries. Has anybody any questions, by the way, in the room? Oh, here you go now. Are you ready? Sorry, just a lady at the front in the white jumper.
Hello, it's Dr. Susan O'Reilly on the board of the Irish Hospice Foundation. This programme's getting going now. It's a multi-year programme. It'll take a while to roll out. But I would be very interested in hearing from all of you experts what you might see as challenges to rollout and implementation, and any thoughts you might have on how best to address them over time.
Easy. Who would like to take that one? I know Tyga's itching to come back in.
Yeah, look, I mean,
he's here.
There'll be no shortage of challenges, absolutely.
But I think, what will they be specifically?
I think, staff burnout I mentioned a few moments ago, I think is an issue. I think we have to address workforce is probably the single biggest challenge in our entire health service, if we're honest. Right across health and social care, recruiting, retaining, supporting staff is the single biggest challenge in my mind. We talk about resourcing, and money is important, obviously, but even if we had all the money in the morning, even if we had all the beds and buildings, we need caring, committed, trained, supported staff to be able to deliver. So that probably is the single biggest challenge. But that said, we've put a man on the moon, so I'm sure we can overcome this challenge as well. And that's why the collaborative approach. I mean, going back even 5-6 years ago, it was kind of, public, private, and voluntary. Like, in my mind, it's immaterial. A resident is a resident is a resident, whether they're over here or over here or over here. So the collaborative approach, and COVID has obviously been hugely challenging. But one of the positives is that integration that we continue to strive for. And working in partnership with each other. So I think workforce is probably the single biggest issue.
Because the will is there, isn't it?
Oh, absolutely. And the resilience is there, and the can-do, will-do attitude. I mean, exemplified through COVID. Hugely exemplified. So, but people need to feel supported, and when they do, fall down or maybe get a bit of a wobble, that there's somebody there to put the shoulder behind them and say, "Hang on a second, we're with you."
Yeah.
And that's what we do. That's what all of us collectively do.
Yeah, sure. So. Kate, you agree with this, of course?
Yeah, and I might add that as part of the development, we did some insight research and spoke to some of the experts and staff on the ground, and we took that learning as well into developing staff support, staff health and well-being as one of the key workshops, and part of that training and education that we will have for the staff as well. So that's as important. The burnout piece is important as well as the staff retention, and we'll be focusing on that as well.
Because people are so dedicated with this work. It's not like, God forgive me, it's not like getting your 20 grand bonus in the bank. This is about work, and minding people who are scared, apart from anything else, who are vulnerable, who are sometimes alone. So you have all of that going on.
And they often have the conversations actually with the non-medical people.
Yes.
I've even noticed that previously. It's the lady or man who comes in to clean the room. It's someone who comes in to bring the meal, and that's when they can have that conversation, because they have that connection, that relationship built up. It's not necessarily ourselves, but I suppose what we do rely on then is them to come out. Again, it's the MDT approach, that team approach, and then you can go in and have those conversations, or just sit in silence. Sometimes, if someone's having a cry or wants to discuss something, silence can be a really powerful tool, when it's used appropriately, obviously,
There's a lot of emotion that still needs to be dealt with after COVID-19 pandemic. Staff were there on the grounds and they did their job. So that can be one of the challenges that we can see, that there might be a lot of emotion for the first onboarding of this program. But I think this will actually also give them a right channel and right opportunity to bring that. So it's a challenge, but it will be a blessing as well.
Of course it will. Of course it will. Anybody else have a question while we're here? Sorry, there's a lady there in the third row.
Hi, thank you very much for inviting us today. I work with the Regional Specialist Palliative Care team in the North East, and we're doing a similar work. We're obviously going to be working with Caru, going into nursing homes and supporting the staff with education, etc. Can I just ask, and I don't need to be, I hope you don't think it's inappropriate, how we would get the buy-in from some of the GPs? It's difficult, particularly if it's an out-of-hours service where they don't know the staff or the residents, and I think there's a need for a trust on both sides. Or, you know, we talk about multidisciplinary team, and I just wondered what advice you would be about getting the GPs locally and nationally on board with the project.
Dr. Gregan?
Well, of course, the project is not aimed at GPs, so we're not listed in I was looking through the list of people it's aimed at, but there are separate programs within the ICGP. One of them is co-sponsored by the HSE and the Irish Hospice Foundation. That's the Palliative Care Certificate course. There's also a nursing home group within the ICGP who run a separate diploma course. So I think embedding it, or at least making those interested parties aware, that would be really helpful from an educational point of view. I think there's a lot of problems in general practice trying to manage nursing homes. We used to have, in my practice, we had 35 patients at one point spread over 14 nursing homes. It was impossible. So we have rationalized all of that now. We go to one nursing home. So instead of, you know, you might have 10 patients in 10 nursing homes, with 10 patients in one nursing home. That makes it much easier. But I think that, you know, time is the enemy of general practice. So if you're going to do regular rounds on 10 people, that's a bought piece of time, and you have to that has to be funded within general practice because you're competing with lots of areas out there. So I think, you know, one of the other things we're doing at the Primary Palliative Care Project, our committee in the Irish Hospice Foundation, is looking at how structural care in palliative care can be delivered in primary care, so primary palliative care. Now, half of the dying we see is in people's own homes, but half of it is in nursing homes. And GPs are involved in a lot of that, diagnosing and prescribing at the very least, if not visiting. And we're trying to look to incentivize GPs to get more involved in that work. So there's a lot of work in the background around general practice involvement. It's not the favourite of every GP, but there are some GPs who absolutely love it. You know, so it's still in flux at the moment how that's.
But why do you say it's not the favourite of some GPs?
I think because of the time factor. You know, if I'm called to a nursing home, you know, I might be called for one person. While you're here, Doc, would you see this, and Mary felt this morning? And you think, well, I've got 2 more calls to do. Yeah.
But
so
that is true, yeah.
That's very difficult. So you really have to structure your visiting to nursing homes, and that requires time out of surgery. And that's, you know, general practice is a business, so that's a business cost to a business, and you have to. If you're buying that piece of time, that has to be properly structured.
Thanks.
Yeah, I do absolutely. And Paul touched on it there. I think, you know, one of the challenges, we've been involved with the special interest group in the ICGP, a very proactive group of GPs who have a strong interest in care of the older person and nursing home care. But ultimately, you know, the issue for me, and we've had engagement with the Department of Health around this, is the GMS contract. I think that's where it needs to be stitched in effectively. Because it is a scarce resource ultimately, and one of the challenges is, I mean, on the one hand, you know, you have under the care and welfare regulations and the national standards the entitlement of a resident to retain their GP in the nursing home. So if they live in Cork, technically they could still retain their GP in Bandon, you know, and that is the right decision because the GP would know them, would know their history and all the rest. But on the other side of that is that, you know, it is difficult to manage that. On the basis of a GP coming to, you could have, you know, a 60-bed nursing home, you could have 10 GPs calling. So you have to ask yourself the question, is that the right use of a resource? But, you know, without making too political a point, I think the GMS contract is where it begins and ends for me.
Just one point, Martin.
Yes,
we as we speak, we have submitted a proposal on this, so it is in the pipeline. We're hoping to hear favourable.
All right, well, let's hope so. Ladies and gentlemen, just to thank Orla and Tig and Dr. Paul and Kate, will you give them all a round of applause? And Vandana as well.
Thank you.
So we're going to wrap it up there. Just to say to those who are watching on the streaming, we haven't got questions here. Those that have asked questions or had queries or whatever, they will be responded to. So you're not going to be left in the lurch. And I just want to thank you all for being here today, for taking the time and the trouble to be with us today. And it's murmurations Murmurations. There's murmurations in the background somewhere. I can't hear it, quite frankly. I should have gone to Specsavers. They do deaf things as well, apparently. But anyway, it's supposed to be in the background. We should thank our choir at the beginning. You're absolutely right. I think they were called Clare's Choir, they called themselves. I don't know where they are, but maybe a ripple of applause just to thank them for being here. It was lovely. You're right. And there is a light lunch outside and no drink, okay? No drink. So happy Christmas and thank you for being here today. Thank you.